This video is going to show you 10 countries where you can get world-class healthcare for way less money than what you'd pay here in America. I'm talking about saving 50% to 80% on doctor visits, surgeries, and even your monthly insurance bills. Whether you take daily medications, need regular checkups, or you're just scared about going broke from one big medical bill, these countries have solutions that could save you hundreds of thousands of dollars during your retirement years. Now, I know what you're thinking. This sounds too good to be true. But here's the proof. Americans spend almost twice as much on healthcare as people in other rich countries. The average American senior pays way more out of their own pocket than seniors anywhere else in the world. Let me give you some real examples. A Prolia injection for bone health costs $1,786 here in America. In Portugal? Just $66. That's the same exact medication. Or how about heart surgery? In the US, you might pay over $100,000 for heart valve surgery. In Thailand, it's around $25,000 for the same procedure with the same quality. I've spent months researching this. I've talked to dozens of American retirees who moved to these countries. They're all saving massive amounts of money while getting excellent care. So here's exactly what we're going to cover today. First, I'll show you the top 10 countries with real cost examples and what makes each one special. Then we'll talk about the practical stuff, like how to actually live in these places, what insurance options you have, and how to make sure you're getting quality care. Finally, I'll give you the exact steps to start exploring these options for your own retirement. By the end of this video, you'll have a complete plan to potentially cut your healthcare costs in half while keeping or even improving your quality of care. Sound good? Let's jump right in. All right, let's start with our first country, and this one might surprise you. Country number 1, Portugal. Portugal is like Europe's best-kept secret for affordable healthcare. Here's what it costs. If you don't have insurance, a private doctor visit runs about $65 to $145. But if you do have insurance, you'll only pay around $17.50. For a couple, good private insurance costs about $550 per month. Now, I know that might sound like a lot, but remember, that same coverage in the US would cost you way more. Plus, this includes 60 days of travel coverage if you want to visit other countries. Remember that Prolia injection I mentioned? In Portugal, it's just $66 compared to $1,786 in America. That's a savings of over $1,700 for one shot. Portugal also has great weather, lots of English-speaking doctors, and it's pretty easy to get residency there if you invest in property or show you have enough money to support yourself in. Country number 2, Costa Rica. Costa Rica has been a favorite for American retirees for years, and here's why. A doctor visit costs about $27 after the government pays back 70% of the cost. They have something called the MediSmart program that costs just $15 per month and gives you discounts on lots of medical services. If you become a resident, you can join their public health system called CACA. You pay between 8% to 12% of your income, and you get coverage for almost everything. The really cool thing about Costa Rica is that many of their hospitals work with Johns Hopkins, which is one of the best hospital systems in America. So you're getting American quality care at Costa Rican prices. Plus, Costa Rica is super stable politically, and there are tons of American expats there already, so you won't feel alone. Country number 3, France. Now, France might seem expensive, but their healthcare is actually amazing and affordable. A doctor visit costs $27, but after the government pays you back, you only pay $9 out of your own pocket. Here's the really great part. If you have a long-term illness like cancer or diabetes, France covers 100% of your treatment costs. You pay nothing. Their prices have been stable for over 10 years, so you don't have to worry about surprise price increases like we see in America all the time. Country number 4, Spain. Spain is another European gem. Private health insurance there costs between $70 to $160 per month. That's it. When you go to the doctor, you typically pay just $5 to $30 as a copay. If you move to Spain and pay taxes there, you can access their public health system too. And let's be honest, Who wouldn't want to retire somewhere with great weather, amazing food, and beautiful beaches? Country number 5, Italy. Italy's public health system costs about $854 per year. Let me say that again, $854 for the entire year. Want a full-body MRI? That'll cost you $40. Need to go to the emergency room? Just $5. Italy has some of the best medical schools in the world, so their doctors are incredibly well trained. Plus, you get to live in Italy. The food, the culture, the history, it's amazing. Country number 6, Thailand. Thailand is the king of medical tourism. Over 20% more people go there for medical care every year. A regular doctor visit costs $20 to $50. Remember that heart valve surgery I mentioned? In Thailand, it's around $25,000 compared to over $100,000 in America. That's 80% less. Many Thai hospitals have something called JCI accreditation. That means they meet the same standards as top American hospitals. Most of the medical staff speaks English too. The hospitals there are so modern and nice, they look like 5-star hotels. Country number 7, Mexico. Mexico is super convenient because it's right next door to the US. If you're between 60 and 69 years old, you can get public insurance called IMSS for just $183 per year. Private comprehensive health plans cost around $590 per year. Compare that to what you pay in America. Overall, healthcare in Mexico costs about 50% less than in the US. Plus, if you have family in America, they can easily visit you. Country number 8, Malaysia. Malaysia is another medical tourism hotspot. Medical procedures there cost about 1/5 of what they cost in America. Their hospitals have international accreditation, and the medical staff speaks English. Malaysia has a special program called Malaysia My Second Home that makes it easier for foreigners to live there long-term. Country number 9, Panama. In Panama, a regular doctor visit costs about $20. If you need to see a specialist, it's around $65. Some of their hospitals work with Johns Hopkins, just like Costa Rica. Panama has something called a pensionado visa. If you're retired and get a pension, you can get discounts on healthcare, restaurants, hotels, and lots of other things. Country number 10, Ecuador. Last but not least, Ecuador. Doctor visits cost $20 to $35, and you can get health insurance for as low as $70 per month. Healthcare costs are just a tiny fraction of United States prices. Many parts of Ecuador have perfect weather year-round. They call it eternal spring. There's a growing community of American expats there, so you'll have people to connect with. Now that you know about these 10 countries, let's talk about the practical stuff. How to actually live there. Each country has different rules about who can live there and for how long. Some countries let you stay if you buy property. Others want to see that you have enough money in the bank to support yourself. Some require you to show pension income. The good news is that most of these countries want retirees to move there because you bring money into their economy. The process usually takes a few months to a couple of years, depending on the country. You'll need to pay some government fees and probably hire a lawyer, but it's not as complicated as you might think. Insurance options. You have a few choices for health insurance. You can join the public health system in most of these countries. This is usually the cheapest option. You can buy private insurance in that country. This often gives you more choices and shorter wait times. You can buy international health insurance that works in multiple countries. This is good if you want to travel a lot or split your time between countries. Most of these countries will cover pre-existing conditions, but you might have to wait a certain amount of time before coverage starts. Making sure you get quality care. I know you're wondering, but is the care actually good? Here's what to look for. Hospitals with JCI accreditation. This means they meet international standards. Doctors who trained in America or Europe. Many doctors in these countries actually studied at top medical schools. Modern equipment and technology. Most of these countries have the same machines and technology we have in America. English-speaking staff. In all the countries I mentioned, you can find medical staff who speak English well. Here are some real stories from real people. Let me tell you about some real American retirees. I've heard talk about their unique situation. John and Mary moved to Portugal 3 years ago. They were paying $10,800 per month for health insurance in Florida. In Portugal, they pay $550 per month and get better coverage. They're saving over $27,000 per year. Susan had cancer treatment in France. The same treatment would have cost her $180,000 in America. In France, she paid nothing because cancer treatment is 100% covered. Bob gets his diabetes medication in Thailand. In America, his monthly medications cost $400. In Thailand, the same medications cost $60 per month. Okay, so how do you actually do this? Here's your step-by-step plan. Step 1. Figure out what you need. First, make a list of your current health conditions and medications. Some countries might be better for certain conditions than others. Think about what kind of weather and lifestyle you want. Do you want beaches? Mountains? Big cities? Small towns? Figure out your budget. How much can you spend on healthcare and living expenses? Consider your family. Do you want to be close enough for them to visit easily? Step 2. Do your research. Pick your top 3 countries from the list I gave you. Consider taking a medical tourism trip. This means you go there for a vacation but also check out the hospitals and doctors. Join online groups for American expats in those countries. Facebook has lots of these groups where people share real experiences. Talk to insurance brokers who specialize in international coverage. They can help you understand your options. Step 3. Make your plan. Talk to a lawyer who knows about international taxes and residency. This is super important because moving to another country can affect your taxes. Work with your current doctors to make a plan for transferring your medical records and prescriptions. Look into temporary insurance that will cover you while you're making the transition. Start the residency application process. This can take time, so start early. Mistakes to avoid. Don't assume you can just show up and everything will work out. Each country has specific rules you need to follow. Don't think that all private healthcare is expensive. As you've seen, it's often much cheaper than what we pay in America. Make sure your medications are available in the country you choose. Most are, but it's good to check. Don't move somewhere without testing their healthcare system first. Take a trip and actually visit some doctors and hospitals. Wow, we covered a lot today. I know this might feel overwhelming, but here's the thing. Thousands of American retirees have already done this successfully. You can too. If this video helped you today, please give it a thumbs up and hit that subscribe button. Now, I want to hear from you. Which of these 10 countries surprised you the most? Maybe you're already thinking about one of them for your retirement. Let me know in the comments below. I read every single comment, and I often make follow-up videos based on your questions. Have a wonderful day, and I'll catch you in the next video.